I'm here at the clinic with Dr. Luis Fernando Sanchez,
Yes.
who is undertaking his last infusion. Would you like to tell us something about your CRPS and how you decided to travel here?
Yes. Well, it all started in late December. I was riding my mountain bicycle and I fell off the bike, and immediately I felt the severe pain in my ankle and hurt and felt the crack. So I knew it was fractured. I went straight to the emergency room and they took some x-rays, and indeed I had a fracture. It was a 3 malleolar fracture and dislocation. The following day I had surgery, very successful. They put an intramedullary nail in my peroneal bone, and also 4 screws in my tibial bone. The fracture healed pretty well. I just had the normal expected pain, and the x-rays are about 1 month after the injury showed that my fracture had healed completely. However, approximately 2 months after the injury, that's when I started with definite symptoms of CRPS. The first thing I noticed was a severe burning pain in my toes, my foot, spreading to my ankle and all the way to the middle of my leg. Burning pain, severe allodynia, in which every step will feel like I was walking over sandpaper or walking over broken glass. Very severe pain. It was non-stop, constant pain, worse at night, and then the swelling came. Initially a red discoloration that will at times turn blue, and all this got significantly worse over the following couple of weeks. So I started taking several medications, initially gabapentin, then Lyrica, and they provided minimal relief. And after that I started taking oxcarbazepine, and that helped, along with lidocaine, 5% lotion and cream on my foot. I started taking a tricyclic antidepressant for the pain and to help me sleep. And I did so for approximately 4 weeks. There was very little improvement. And I saw all the signs of CRPS. I'm a neurologist, so I convinced myself that I had that. I went to see a friend of mine, a pain management doctor, and he saw me, he examined me, and he agreed that I had CRPS. And he offered me the treatment that he offered. He said, well, in my experience, the only thing that works is a spinal cord stimulator in the DRG. I didn't like that idea too much of having cables in my body, and all the nuisance and problems and inconveniences that will entail. So I went to see another doctor a week after in a city that is close to my hometown, and the doctor examined me, saw him, and same diagnosis, CRPS. And he offered me a spinal block, a sympathetic lumbar spinal block, which we did 5 days later. So this will be approximately on the 7th week after the onset of the CRPS. And I had this spinal block with anesthetic and also Botox. And that helped. The discoloration went away. The health decreased about 20-30%, but I continued with the symptoms. Then I injected myself with exosomes, which is a derivative of stem cells, and also with Botox, local injections of Botox in the ankle and the foot. And all those things help. But I wanted something that will help me to actually treat the underlying cause of CRPS, and that's when I started researching about biphosphonates. And the one that distinguished itself from being most effective was Neridronate. and the only place where it is available is in Italy. So that's when I contacted the clinic, and I went through the process. It was very easy. I contacted Sandra, and she was very helpful. She gave me all the necessary information, and that's when I got here.
Yes, and how was the treatment? Now we are at the last day.
Yes.
So how was it?
This is the fourth and last infusion. I haven't had any side effect whatsoever. No fever, no pain, no headache, no fatigue, no nothing. I've been feeling well, no side effects. I still haven't noticed the benefit of the medication, which I think is going to take a few weeks to start. But my experience has been great. Everything has been positive. I have no complaints whatsoever. I'm very happy I came.
Thank you. So as a doctor, do you think that you could suggest it to other people in the same condition? You think that it is a good option for people with CRPS, as you did? I'm interested in your opinion because you are a doctor, so you are much more knowledgeable on this, you know.
I think this will be the best treatment option, because it's the one that probably offers the best chance to stop the progression of the disease and eventually cure it, as opposed to the medications and treatments that we use in the United States, which are palliative, what we call palliative, that we treat only the symptoms, we treat the pain, the burning, the swelling, we block the nerves, and that reduces the pain and the discomfort, but it doesn't target the pathophysiology of the disease as the Neridronate does.
Yes, it is meant to work on the roots of the disease, so this is the most important thing.
Yes.
What about Verona? Did you enjoy Verona, the hotel, the food?
I'm in love with Verona. I'm in love with Italian people, with the food.
Oh, you are in the city of love.
Yes, I've been having a wonderful time here.
Yes. It has also been the city of rain in these days, unfortunately. But
it's been raining, but there are enough things to do in the city. We've been visiting museums, trying to stay indoors, and the rain hasn't been bad. I mean, we just an umbrella.
Did some shopping.
Yes.
You are even going to a concert tonight.
We're going to the Philharmonic.
Very busy.
Tonight, and hopefully tomorrow, if I can get tickets to the opera, probably we will go. And I've been combining the treatment with the relaxation, with visiting the famous tourist places, which Verona has many. Verona is famous for the House of Giulietta, but no, that's just one of the many things that are to be seen in the city.
Yes, correct. You are right. Okay, so thank you for coming here, for being with us. I enjoyed very much staying with you. And most of all, best wishes for your recovery, which will start progressively in the next weeks. And we will keep in touch, so we like to know how you are doing, your progress, and if you have any question for us and for the doctor, we will be glad to reply to you.
We'll be in touch.
Okay, thank you very much.
And I also want to emphasize the work that Lorena has done for us. She's been just wonderful, amazing person, very charming, very warm, very lovely.
Thank you.
We appreciate a lot what you've done for us, Lorena.
Thank you. I know that you also like very much our nurse.
Oh yes,
Marcia,
yes, Marcia.
Great also.
Yes, it's one of the few that does painless IVs.
Yeah, she's very, very good.
It feels just like a mosquito sting. She's great.
Okay, so thank you very much. Now I will let you enjoy the last infusion.
All right. Thank you.
Okay, thank you, and then we will keep in touch. Best
Thank you,
wishes
Lorena.
from all our team.
Hi guys, welcome to Let's Talk About CRPS. Today we have a very, very special guest with us. We have Dr. Sanchez. He's a CRPS patient that came to us last year for the treatment with Neridronate, but he's also a neurologist, and we are so happy to have you with us on the podcast. So hi and welcome.
My pleasure to be with you. Thank you. And my pleasure to share my experience. Yes.
So I'll let you tell us a bit about your CRPS story and how you got to us and all of this, and then we'll just dive right in.
Sure. Well, everything began in December 2022. I was riding my mountain bike, as usual, every weekend. And this time I fell. I had a pretty bad fall. And I was doing wheelies, something that I probably shouldn't be doing at my age. I'm almost 60 years old. Next year I'm going to be 60. And so I fell backwards and I landed on my right foot. But my foot unfortunately landed on its side, and it twisted my ankle, and I fractured my two leg bones, the tibial bone and the peroneal bone. Mm-hmm. They were shattered. So I had what we call a trimalleolar fracture, dislocation, and a sprain of the ligaments and tendons of the ankle. So right after the fall, I drove myself to the emergency room, and I had X-rays, CT scan, MRIs. And the following day, I had surgery. They put a plate, screws, probably 8 or 9 screws, and a rod inside my bone. It was painful, not a good experience, but everything went well for the first 6 weeks. I was healing fine. Mm-hmm. As a matter of fact, I had X-rays more or less 4 to 5 weeks after the fracture, and my bones were healing perfectly. Actually, it was very hard to see where the fracture had been. Mm-hmm. However, a week after that, which will be more or less 6 weeks after the initial injury, we're talking about mid-February of 2023, I started developing a different kind of pain. It wasn't the usual pain of the fracture that was an aching, deep bone pain. Mm-hmm. This was a totally different kind of pain. It was a burning, tingling sensation that will wake me up in the middle of the night, or I will wake up with pain, mm-hmm. something totally different. Then as days went by, I started developing other changes. My foot will all of a sudden turn blue, bluish, grayish, or dusk, mm-hmm. and swelling. I will wake up with swelling from the mid-leg down to the toes. Initially, my swelling was just around the ankle and from the ankle down to the toes. But now the swelling extended and it went up to the mid-leg as mm-hmm. well as the pain. And from that point on, the pain increased to a point in which I was having pain pretty much all day long, day and night. I'm a neurologist, so I realized I was having symptoms of CRPS. For example, just the touch of the bed sheets on my foot will be significantly painful, mm-hmm. or trying to step to walk and taking a few steps will be incredibly painful. It will feel like walking over broken glass, mm-hmm. And that sensation just kept on getting worse. So I diagnosed myself with CRPS. Mm-hmm. I just didn't want to take just my word for it. So I went to see a friend of mine, a pain management doctor. Okay. He saw my foot, and it was swollen, sweaty, very painful, very sensitive. And he told me, yes, you have CRPS. So I started the usual treatments that we prescribe here in the United States. Gabapentin, mm-hmm. pregabalin, different anti-inflammatories, and what we call so-called antidepressants, which are just pain modulators. To tell you the truth, nothing worked. If something, I will get probably 10% relief of the pain at the expense of significant side effects. I was very drowsy, dizzy with the effects of the medications, and obtaining minimal relief. So 2 weeks after that, I underwent what we call a lumbar sympathetic block,
Mhm.
in which under fluoroscopy guidance, the doctor injects an analgesic, usually a local anesthetic. And in addition to the local anesthetic, I had Botox injected also at the site. I was very hopeful for the treatment. Unfortunately, it didn't work. It didn't touch the pain. If something, probably it was just a placebo effect in which I will get just another 10% of relief. Then, well, I started down the path that we usually do here in the United States. So I injected myself with Botox all the way from the toes to the mid leg. And again, that provided maybe another 10% relief. 2 weeks after that, I ordered some stem cells from a local laboratory here in Florida. And since the stem cells are prohibited here, what I ended up getting was exosomes, which is the actual use of the stem cells. It's what works from the stem cells. So I injected myself with exosomes. Initially, the exosomes cause inflammation, but then they are supposed to decrease the pain and the inflammation itself.
Okay.
And yes, I had a slight improvement with that. So now we're talking about March. I was unable to walk. I was unable to work. I was pretty much bedbound and homebound. It was a horrible experience. I know about the biphosphonates, and here in the States, most of the biphosphonates that we prescribe for CRPS are oral biphosphonates. Very few doctors prescribe intravenous or intramuscular biphosphonates for CRPS. I started doing some research about what was available abroad, because I knew I was reaching my limit here for what we have here in the States. The suggestion of my friend, the pain management doctor, was to undergo a spinal cord stimulator, particularly and specifically a dorsal root ganglia stimulator, which statistically provides just about 30% relief. And once you have that device implanted on you, then you are limited because you have cables in your body with a battery attached, and then you are very limited in what you can do as far as activity. So I didn't want to take that route. I started doing more research, and of all the bisphosphonates available, the ones that had the best record was Neridronate. Of all of them, there are approximately 12 biphosphonates in the market now, and Neridronate was number one for CRPS. Incredibly, it was just available in Italy. I didn't know about that. So doing more research in the internet with Google Scholar, I found out that the best place to obtain this treatment was through MTI, Medical Tourism Italy. And that's when I reached out to you, and I scheduled my treatment and everything, and we can take it from there.
Yeah. So do you wanna tell to everyone listening what were the results of the treatment for you?
Sure, absolutely. You know, I didn't know anyone that had been to Italy or to MTI to receive this treatment. So I was very hesitant. I didn't know if this was going to be a scam, because it was just an online video chatting, and I had to send at least 50% of the cost of the treatment before actually receiving it. So, you know, nowadays, with so much fraud online, they say, well, what the heck? I may lose some $1,000, but I wanted my health back. I was miserable. I couldn't work. I couldn't do anything. So instead of saying just 50%, I said all the fee, 100% of it. Landed in Verona, Italy, and I was greeted by Lorena, a great person, incredibly warm and lovely person. And I felt immediately safe and at home with her. She made it so easy. So this was in May of 2023, actually May the 7th, when I landed with my wife in Verona. It was a Sunday, and the following day, Monday, I received my first treatment. Before that, I met Dr. Carbonari, I think is
Yes.
right. Yes. He's a great doctor, a great person too. So we since I'm a physician too, we immediately connected.
Yeah.
And he saw my medical record, examined my foot and leg, and said, yes, you have CRPS, and I think you're going to benefit from it. So half an hour after speaking with him, I was already on bed with an IV line on my arm and receiving the treatment. And the nurse was wonderful. She was very caring, and I'm usually afraid of needles, but she made it so easy. And it wasn't painful at all. I knew by reading about it that Neridronate can have some side effects. So I was expecting to feel something, either fatigue, fever, pains, but actually I didn't develop any side effects. And so I received a total of 4 infusions during 1 week. No side effects whatsoever. I was able to hop around in downtown Verona. I had a great time there. I love Italians because you guys are super friendly and very warm people. So I love your country. I love the people. I love the food. I love the culture. So I had a great time there. I didn't feel any relief for the first 2 weeks. But about 2 weeks after the last infusion, that's when I started noticing decrease in the pain, decrease in the swelling, and the bluish and dark coloration that I was getting started going away very gradually, little by little. And I can tell you that 6 weeks after the last infusion, I was almost back to normal, probably 90% better. I was able to walk barefooted, to put my socks, my usual shoes. Incredible. So I was very grateful. And for me, it was an excellent and an incredible response that we rarely see here in the United States.
Okay, so that's on your experience as a patient. Now I want to kind of dive deeper in your experience as a physician towards CRPS. So most of the patients that we have followed are having a really hard time to find a doctor who knows about the condition and then getting a diagnosis. Had you treated patients with CRPS before getting it yourself? Were you aware of the condition before getting it yourself?
Yes, I was aware of it. As a matter of fact, CRPS is one of the conditions that we neurologists diagnose and treat. In Italy, it seems to be different. It seems like rheumatologists are the first specialists that get to treat this condition. Here in the United States, it's mainly pain management doctors. We neurologists usually make the diagnosis and treat this condition medically with different medications, anti-inflammatories, analgesics, and pain modulators, such as gabapentin, pregabalin, and different antidepressants. Since most patients do not respond to this treatment, unfortunately, they resort to opiates, to morphine-like medications. That, yes, they provide some relief, but unfortunately, down the road, instead of helping, they produce a paradoxical effect, which is called opioid-related hyperalgesia, which means that If you continue the treatment, instead of getting relief, you're going to have the same pain you had before or even more. CRPS is not a common condition. Most of the injuries and sprains, strains, fractures that most often occur in a limb, upper or lower, they heal fine without developing CRPS. In a few people, the statistics vary from country to country, but here in the United States, the statistics are about 5 to 10 people per 100,000 population. That's the CRPS incidence that we have. The prevalence is higher because it's a chronic, painful, debilitating condition. Most doctors are not familiar with CRPS. They've never seen it. And consequently, if they see it, they fail to diagnose it.
Yes.
They attribute the condition to either an exaggeration of the pain sensation by the patient, or they diagnose it as just edema, swelling that occurs after an injury that just doesn't go away. And some of them are diagnosed with lymphedema.
Yes.
So there is a delay in the diagnosis. There's also the problem with misdiagnosis. And that, unfortunately, if you don't treat it soon enough, it becomes even more difficult to treat and to actually go into remission. I'm very fortunate that I'm still in remission. And I'm in my mind, because the mind is so powerful, I consider myself cured. I know that that's pretty much outreach as far as the treatment response, but that's the way I feel, and that's the way I want to believe it. So yes, we have that problem: misdiagnosis, underdiagnosis, and consequently mistreatment.
Yeah. Do you think that at the same time there are a lot of misdiagnosis of CRPS? Do you think a lot of patients are diagnosed with CRPS when it isn't the actual diagnosis for the patient?
Exactly. We have patients that CRPS that are diagnosed with something else, and also the opposite condition, in which patients that don't have CRPS ended up being diagnosed with CRPS.
We have come across during the years, just in some cases, the doctor that you saw, Dr. Carbonare, did mention, according to me, I don't think this is a CRPS case, and it's difficult because once a patient goes through, one or two diagnoses from physicians in the States, it's difficult to kind of pass this message of this possibly could be a misdiagnosis, but it's something that has happened even to us. On the small percentage of CRPS patients that we see from the States,
Yes.
Do you think that the diagnosis of inflammatory conditions could be related to other things like the way of life, so the diet, a poor physical activity, and so on?
Yes, you're right. There is a significant influence of the lifestyle that we have here in the Western world. We're suffering an epidemic of obesity, poor physical activity, and the diet that we have is so poor that it actually works against us. It's so unhealthy, full of processed food. It's what we consider an inflammatory diet. When you have a condition such as CRPS, it just makes it worse. There was a recent study that claimed that approximately 88% of the US population are metabolically unhealthy. 88% of the population. So that's pretty worrisome. That number came taking into consideration several criteria. The main one was the body fat percentage and the consequent insulin resistance, which are factors that if you have a painful condition such as CRPS, it aggravates it, it makes it even more painful than otherwise it should, and also longer lasting.
Yes.
So our lifestyle is definitely a significant contributor to the development and the perpetuation of CRPS.
So you, in your case, you were lucky enough to come very shortly after diagnosing yourself with CRPS. But in longer cases, which is why we have implemented the 360-degree treatment, do you agree that in longer cases and in cases in which the nutrition and the poor physical activity is present, it is important to have a multidisciplinary path that is not just the infusion itself, but also, like, we implemented a nutritionist visit to help you with the anti-inflammatory diet, and then a physical therapy program, and so on, and all the things that we have implemented in our program.
Right. We have a lot of problems doing that multidisciplinary approach because of the medical insurance environment in which we live. Most patients have a gatekeeper, which is a primary care doctor. Primary care doctors, through their training, are actually very unfamiliar with CRPS. They are used to treat just the most common conditions, and CRPS is not a common condition. So they often fail to diagnose it and fail to refer the patient on time. Once the patient gets to be referred, again, it's usually referred to a pain management doctor that prescribes the usual medications that we already mentioned, pain modulators, and then the opiates, and then procedures, the sympathetic nerve blocks, and the spinal cord stimulators. Very few of them are lucky enough to get a multidisciplinary approach that should include lifestyle changes, particularly diet, physical activity, physical therapy, sleep, relaxation techniques. It should be a multi-pronged approach that is, again, very difficult to obtain here. There's a few CRPS centers here in the United States, but that unfortunately don't take private insurance. And it's actually extremely costly. We're talking about anywhere between $50,000 to $100,000 for a 6-week treatment.
Wow.
And the percentage of patients that actually get any benefit from that treatment is low, probably 30 to 40%. And even those numbers are skewed because it includes patients that actually didn't have CRPS, that had other conditions, depression, anxiety, post-traumatic stress disorder. So the placebo effect is very important there. It plays a significant role. Yes.
So, in your opinion, why do you think that Neridronate wasn't approved in the US, given that it has shown so much positive results in a healthcare system such as ours, and is now a basic treatment for the condition? What do you think it hasn't been approved in the States?
Well, here in the United States, we're notorious for trying everything else except the right thing. Once we go through everything that doesn't work, then we try what works.
Okay.
Yes, it's unfortunate. The medical system in the United States is geared towards the most commonest conditions, which are degenerative diseases. The ICU care, intensive care unit care in the States is probably the best in the world. But other than that, no, we do poorly. I think last time I checked, France was number 1 and Italy was number 2 in the world as far as medical care quality. So even though we spend a lot of money in medical care, hospital care here, we don't get what we should. And I don't see any solution to that. There's no incentive from the insurance companies or the government to change this. So I don't see any significant change in the short-term future about this.
So then what would you be your word of advice, and what would you be saying to a CRPS patient as for what's the best course of action for them just as soon as they have a diagnosis in hand?
Yes. If you have an injury, a sprain, a fracture, that doesn't heal the way it's supposed to, that the pain continues beyond the expected duration, that the pain spreads to an area beyond the area of injury, that the pain that you experience is way more than what is expected, that you start developing other changes. For example, in the Budapest criteria, we have the sensory changes, which is allodynia or hyperalgesia. Allodynia means that any stimuli, for example, a light touch on your limb that normally shouldn't be painful, feels extremely painful. And hyperalgesia means that something that is usually painful feels significantly more painful. And that does not occur in the typical injuries. That's the first and commonest sign of CRPS. Another sign is what we call vasomotor changes, skin color changes. Bluish, the foot, ankle, hand, arm, any area that is affected by CRPS will start showing different discoloration. That, again, in a normal injury should not occur. Usually after an injury, there's swelling within the first 2 or 3 weeks, and after that, you should have a gradual improvement in the swelling, the pain, and the bluish discoloration due to the black and blues of the injury, the chemosis. With CRPS, that instead of getting better, gets worse. And so those are red flags. If you start developing those red flags, you should immediately request an appointment with a neurologist, and then try to introduce to the doctor the option of receiving bisphosphonates. Here in the United States, we have Neridronate, which it's in a way similar to Neridronate, but not as effective. When I did my research on Neridronate, the efficacy percentage of Neridronate was close to 90%, 85 to 90%. With Neridronate was 65 to 70%, so lower. And in addition to that, the duration of the effect with Neridronate was approximately 6 months. With Neridronate, it could be 10 years or even lifelong. So big difference. That's why I decided to go to Italy to receive Neridronate. I could have gotten Neridronate here with one of my friends and get infusions and see what happens, but no. If I decided that if I was to receive a biphosphonate, it had to be the best one. I didn't want to take more chances with my health.
Absolutely.
Once you lose your health, you lose everything.
Of course.
Because you then can't work, can't enjoy life, cannot do anything. So health is our most precious gift of life. Without it, there's no life.
Absolutely. Okay, well, thank you so much for answering all my questions today, and thank you for participating to this podcast. I think it's very important to have the input of someone who both underwent the treatment but also is in the medical field in the States. I think that is reassuring for all our listeners that are based in the States. So thank you so much for being here with us today. And
you're very welcome.
And so for everyone listening, we'll see each other on the next episode of Let's Talk About CRPS, and we'll say bye to Dr. Sanchez, and thank you so much for being with us again.
Oh, my pleasure. My pleasure.
Bye. Thank you so much. Bye-bye.
Bye. Bye.